Okay, I'm Bruce Donald with Result. I'm the Chief Operating Officer, and we provide all the non-medical services for Commonwealth Anesthesia Associates.
My name is Michelle Lilly, and I work for Result and Commonwealth Anesthesia Associates, and I am the Director of Quality here.
We had one employee, and then, believe it or not, I did a lot of the IT, so there's a problem. Just saw a picture of our first IT setup, which was in 2000, and it was a Hewlett-Packard computer, one phone line coming into the computer, and that was our technology. So security, all those things from 2000 to today, 2021, huge changes. I think there's several ways that Solvaria really helped us. One was at the board level. Our board members, who are all anesthesiologists, knew they wanted a good system and good environment for IT, but we needed a consultant to assess that. So that was really the first role that they played. Then the second role was implementing that assessment over a period of time. One good example is here during the COVID period. Because of all the infrastructure that we had with Solvaria's help with the virtual private network, we were able to deploy all our people to home in 4 days in a totally secure environment. And that was huge for us. It allowed us to keep working.
Yeah, so as our fractional CIO, they've provided tremendous support in any areas where we have any gaps or needs. In particular, the project that I was involved the most with was our implementation of our anesthesia information management system. They were involved with us for the review, decision making, and then installation and rollout of that. We call it our AIMS, or Anesthesia Information Management System. It's known as mid-action. Right, so Greg was just so instrumental in that implementation, because we had to work with the hospital staff and with the software vendor, and then internally with all of our staff to pull all those groups together for that implementation. But in particular with the interface with the hospitals, we had to create interfaces for patient schedule feeds into mid-action, and we also get demographic information electronically transferred as well. And so he worked very closely with the hospital staff to establish those connections and those interfaces and make that all happen, which is not easy as a contractor in a hospital facility. Those things tend to be lower priority. So that was challenging to make that happen, but we got it done with Greg's help.
Yeah, the processes are really the biggest piece now. We get real-time feeds from the hospital for mid-action. We get feeds on patient demographics from the hospitals. We have interface programs. We have backups now that are off-site and more secure. It's really a comprehensive plan. You almost have to lay that out and say, that's why you need a Solvaria. Obviously, very important to us because of HIPAA requirements. So we've got to be sure that we're in compliance with HIPAA. Again, we have a lot of patient medical information, unfortunately very valuable to people that are not nice people.